He took one antibiotic tablet. Within minutes, he felt itching, then swelling. Then he could not breathe. His blood pressure dropped. Panic everywhere. This is not just an allergy. This is anaphylaxis, a life-threatening emergency that can kill within minutes if not treated immediately. Hello viewers, I am Dr. Muki presenting you a new video on anaphylaxis. In today's video, I'll explain what exactly anaphylaxis is, why it happens, the clinical signs you must never miss, and most importantly, the step-by-step emergency management of anaphylaxis. So, stay with me and watch till the end because this knowledge can save a life. Let's begin. So, before we begin, we have to know what anaphylaxis is. So, anaphylaxis is a severe systemic life-threatening allergic reaction which is rapid in onset and it affects multiple organ systems including skin, respiratory system, cardiovascular system, gastrointestinal system. And the most dangerous complication in anaphylaxis is airway obstruction and shock. Let's understand the pathophysiology of anaphylaxis in a very simple way. Most cases of anaphylaxis are IgE mediated reactions, that means immunoglobulin E mediated reactions. So when a person is exposed to an allergen or pollutant, the immunoglobulin E antibodies bind to the mast cells and the mast cells release histamine and other mediators that cause massive vasodilation for which there is capillary leakage and that cause bronchoconstriction and the result is hypotension, airway swelling, breathing difficulty and circulatory collapse. This is distributive shock and it progresses fast. Let's talk about the common triggers of anaphylaxis. The most common causes of anaphylaxis include first foods like nuts, shellfish, milk. Secondly, drugs like penicillin, NSAIDs and contrast agents. And third one is like insect stings. Fourth one is latex. But remember, sometimes the trigger is unknown. Now, what are the clinical features of anaphylaxis? In general, symptoms usually occur within minutes of anaphylaxis. So, the symptoms that are seen in skin are first is urticaria, second one is itching, third one there will be angioedema. Remember one important thing, anaphylaxis can occur even without any skin rashes. So the clinical features in respiratory systems are there will be wheezing, stridor, dyspnea and throat tightness. And the clinical features in cardiovascular systems includes hypotension, tachycardia, dizziness and syncope. And the clinical features in gastrointestinal are vomiting, abdominal pain and diarrhea. So if hypotension or airway compromise is present, treat immediately. Never ever wait for the lab confirmation. So let's talk about the most important part of this video, the management part. Let's understand the management of anaphylaxis step by step. So this is where lives are saved. So step 1, if you see any anaphylaxis patient, just first call for help. This is an emergency situation. The second step is like IM adrenaline injection, first and most important antidote for anaphylaxis. Injection adrenaline So adrenaline is the first line treatment of anaphylaxis. The usual adult dose for adrenaline in anaphylaxis is 0.5 mg IM, that to be given in the anterolateral aspect of thigh, and have to be repeated every 5 to 15 minutes if needed. Never ever delay in giving adrenaline. Sometimes we do a mistake by giving antihistamines and steroids as the first line of treatment. Usually this is not the first line of treatment. Always go for injection adrenaline. Antihistamines like Avil and steroids like hydrocortisone are the secondary. We can give after giving the adrenaline only. So the third step of management of anaphylaxis is like position of the patient. The patient should be lay flat and the leg should be elevated. If there is vomiting, keep the patient on lateral position, preferably in left lateral position, to avoid or to prevent aspiration. If there is difficulty in breathing, allow sitting slightly upright, and sudden standing can cause cardiac arrest. So never allow a anaphylaxis patient to stand up all of a sudden. And the fourth step is oxygen therapy. We have to give high flow oxygen via mask. And the fifth step for the management of anaphylaxis is to make sure to do the IV access and give IV fluids. We should access the large bore IV line, and we have to give rapid normal saline bolus. Remember, this is a distributive shock. We have to give IV fluids. And the step 6 in the management of anaphylaxis is like adjunct medications. Like after adrenaline, give H1 antihistamines, like I have already told, like injection Avil, and give corticosteroids, and nebulize with salbutamol if there is bronchospasm. But never replace adrenaline with these injections. These are secondary. The primary treatment for anaphylaxis is adrenaline. Again and again I am saying this because keep it in mind that adrenaline is the only treatment for anaphylaxis. All other antihistamines and steroids are secondary. So do not delay in giving adrenaline. So let's talk about the reactions, like the biphasic reactions. The symptoms can return after 6 to 12 hours. So it's better to observe the patient for at least 4 to 6 hours in mild cases, and in severe cases it's better to observe for 12 to 24 hours. Let's talk about the common mistakes. The common mistakes that's usually done by any medicos. The first one common mistake that usually done is like delaying in giving injection adrenaline and giving IV antihistamine first is another common mistake. And the third one most common mistake is like underdosing adrenaline. Like we have to give 0.5 mg and the patient is not receiving 0.5 mg IM every 3 to 5 minutes. And the fourth one common mistake is like discharging the patient too early. And regarding the discharge, if I say, the patient party should also understand about the condition of the patient. In generally they think it's nothing, it's just a skin rash, give some antihistamines and lotion, it will be okay. But sometimes they really don't understand the seriousness of anaphylaxis, and they usually take like discharge on request. So this is a common mistake that can lead that person to death. Adrenaline saves life, delay kills. So anaphylaxis is unpredictable, it is rapid, it is deadly, but it is also completely treatable if recognized early and treated directly. Remember, AAF for airway, for adrenaline, and for fluids. If you found this video helpful, share it with someone in healthcare, because one day this knowledge might save a life. If you like this video, kindly do me a favor by like, share and subscribe, and do not forget to click the bell icon to get notifications. Thank you.